Well, thank you, Megan. And I just want to give a little bit more background. That's kind of my professional curriculum vitae that she was talking about, which hasn't been done in a few years because I've really been focused on trauma the last few years. And I have to say that it has made sense of everything that I didn't understand before. Starting in the late 1980s, early 1990s, we began to see children in our center that were having behavioral problems, and we couldn't figure out why. We couldn't figure out what it was. First, we thought, well, maybe it was, the parents had been abusing substances, and maybe it was a result of that. That was kind of something in the early 90s. I saw Bruce Perry at an NAEYC conference, and I began to follow his work. And then in the early 2000s, Jack Shonkoff's work on all of this, what's going on with children and behavior and the brain and everything. But it wasn't until maybe 5 or 6 years ago that I came across adverse childhood experiences and realized that it was all of the puzzle pieces that were missing. And so I've kind of gone down a rabbit hole, as it were, about this. And I was just talking to Megan earlier how this really affects everything. And we'll talk briefly about COVID-19 and social justice, but they all have an impact from adverse childhood experiences, which in other words, basically is trauma, children and trauma. So let's get started here. We have some recent events. The understanding of adverse childhood experiences. This came about in the late 1990s when a weight management physician in San Diego at Kaiser he was doing this weight management program, and he started inquiring upon what the childhood and their, the backgrounds of all these people were. And one of the things that they seem to have in common is that they had some big major issues when they were children. And so they followed it through, and they came up with 10 questions and asked these questions of their patients, and they made it a bigger group. And then come to find out that a great majority of those people who had a weight problem had some sort of childhood trauma, one of those ACEs. And so that's led to the CDC getting involved, and they did a test of many more people, and they were convinced. So the CDC got on board in their early 2010. What is kind of questioning by a lot of people is, why didn't this get wider range support and advertising sooner? Instead of being broadcast out, it was discovered little bit by little bit by little bit. And it wasn't really until like 2013, 2014 that it began to really take traction and catch a lot of things, including a lot of people, including physicians. And, physicians are the physical caregiver, but it's also affected students in classrooms greatly. And to give you an example, I have a friend who teaches with me. She's also semi-retired, and she had a caseload, I want to say around 100 when she started. And when she finished, when she retired a couple of years ago, it was up to 500. The local school district that my children and grandchildren have gone to had one therapist or counselor for the whole school district. In my granddaughter's school, they now have 3 in one school. So this just tells you things have changed, and we really can't ignore it. So we have COVID-19 has had a big impact on a lot of people, and for some people, it may be considered a traumatic experience. Supporting equity and social justice. Equity and social justice do have an effect on us, and it can be considered a trauma for some. And then we need to understand all of this information about trauma, because we need to change how we teach, and we need to respond to kids differently than we have been. So ACEs are basically childhood trauma, and it's an event that frightens the child. It can be dangerous, it can be violent, it poses a threat or a perceived threat to the child's bodily integrity. And these feelings can come up if they have witnessed a physical threat, say domestic violence, or something along that line, or community violence, if they have witnessed this. Even for some children, watching something on television can be a big issue. So that is the National Traumatic Stress Network's definition. The Substance Abuse and Mental Health Services Administration, under which the National Traumatic Stress Network operates, defines trauma as a single event or a series of events or a set of circumstances that have a long-lasting and harmful effect. And it does on the overall functioning and well-being. And when you really get to look at this situation, you will begin to understand why your students or you yourself in a classroom have seen more and more children who are out of control, crying, having tantrums, being aggressive, or shutting down. It's that fight, flight, or flee mentality that is happening at a greater rate. And about 1 out of 4 has experienced one form of child trauma. This figure was from about 1.5 years or 2 years ago. It depends on the source. A lot of people are including COVID-19 in that, and so that number increases. But 1 in 10 children have 3 or more ACEs. Now, if you have a ratio of 1 teacher to 12 children, and that would indicate that at least 1 student in your class has 3 or more ACEs, and 2 other students have at least 1 ACE. So you potentially have 25% of your classroom or more that have ACEs. I think that we could probably say it may be even more than that. And it is also estimated that as many as 1 in 3 teachers of very young children have experienced ACEs. And that may be one of the reasons they're in that job, is that they want to make life better for children than it was for them. So they may be easily triggered. So you have to consider all of these things. And the other thing is that all that's being done, and there's a lot done for elementary and high school, middle school kids around trauma and ACEs, and not much done in early childhood, where we can make a difference. And that's kind of why I've gotten on this soapbox. I am in the beginning stages of writing a textbook. So these are the adverse childhood experiences, and there are more. These are the ones that a combination of what the Kaiser and CDC study had, and then there is a group in Philadelphia who went beyond that, because they said this doesn't include some other information. So this is the Philadelphia ACEs also. This is all kind of combined together. So any kind of abuse or neglect, and neglect is really big in this. Physical, sexual, emotional abuse. I know when we studied in the early 90s, we were studying women who were getting involved with substance abuse, that about 90 to 95% of them had been sexually abused as children. And this is another thing. We're seeing a lot of homeless. We're seeing a lot of adults who are on drugs. We're seeing a lot of deaths. This all can be related back to trauma. Domestic or community violence, seeing that violence, the substance abuse of the parents. And this is something to consider, because in many cases, this is generational. And it may be actually ancestral. It can go back for many, many, many years. But the substance abuse of mothers of children may be caused by their abuse themselves. So that substance abuse, which may be affecting the co-regulation, the relationships, may cause neglect, do other things, may have another broader background. Natural or human disasters or panics, you know, if you've lost your home to fire, if you've been in these days, if you've been in a blizzard, you know, that sort of thing, or if you live in that town in Ohio where the train derailed, that's a human disaster. Many people had to leave their homes. That disrupts the development, and it disrupts the family dynamics. And the pandemics, and pandemics, the only one that we've known now is COVID-19. But I remember my mother talking about in 1918 when the Spanish flu hit, and her brother had it. He did survive, but you know, it did change childhood for some of those people. The sudden loss of a loved one. So this could be through death. It could be through divorce. It could be through incarceration, where you're losing a family member. Bullying. And bullying is something that happens even in the workplace today. It happens in preschool. It's been happening, and some school districts are doing something about it, and some are not. And bullying today not only occurs in person, it is relational over social media. And that's a whole other can of worms. If a child has a serious accident, such as an automobile accident or something like a ski accident, and they are hurt, and they have a long recovery, that can be an adverse childhood experience. Or a life-threatening illness like cancer. Homelessness, housing instability, or food insecurity, all of those things can relate. And this was a big thing during COVID because of people not being able to work, and you know, were afraid that they were going to get evicted, or did get evicted, and didn't have enough food to eat. And I have had students who work at the rescue mission, and you know, all of these things have been a big issue for a lot of their families. Military family related stressors, and that includes being deployed. And in fact, I told you about the small school that it's, I think, 550 kids where my granddaughter goes. And my daughter-in-law, her aunt, actually is the therapist at that school for the military families. They actually have a therapist for the children in the military families. Refugee or war experiences. And we're seeing now the influx of some families from the Ukraine, and those children may have issues that are brought here from that. And then we have, and we've got this going on now, basically racism, homophobia, systematic suppression, all of those can be considered an adverse childhood experience. So what does this do to children? This does a number of things, and you can see this: historical trauma, social conditions, the experiences. This is a huge one, the disrupted neurodevelopment, and it affects everything above here. So the risk factors that go with this is how serious is this event? Is it something that is major? Like neglect is over time can be very severe, especially if there isn't any relationship developed between mother and child, or the relationship is there and then it's not there, where it is ambiguous. You don't know whether you can count on your mother or not, and that can have an effect. The reactions of the caregivers. Now, if you have something that happens, like say a child has cancer, and you have a parent who is devoted to that child, that's going to be a big help for a child. But if you have a child who has been neglected or has been sexually abused, it's actually maybe the caregiver that's doing the damage. So that has an effect. Family and community factors, the stability of the family, the health and well-being of the community. Is there support? Is there something going on that can be helpful and supportive? The prior history of trauma, and how many times has this happened? That's why we say ACEs, if you're talking about 3 or more, this means something has happened more than once, and something takes a toll if you add those up. And then the proximity to the event, and this means, like, are you in your house watching domestic violence? Are you seeing it in the community? Are you seeing this violence? Have somebody pulled a gun in your home, or have you seen guns pulled on the street? Did you experience the fire situation, or did you see it on television? And the other thing is the age. And they have, in the last few years, have discovered that if a child is under the age of 1, it will have lasting permanent damage. And that is because of the cognitive and the brain development and the development of the neurosystem, that if all of the things that should be happening in that first year of life don't, then it can affect the size of the cortex of the brain, and it has a major issue. So we have 3 kinds of trauma, and basic trauma basically is an experience that threatens, you feel the threat of your life or your physical integrity, and it's so overwhelming, it's difficult to cope. That could be anything from an automobile accident to being in a blizzard or a tornado or something along that line, to not feeling the experience of being attached to your parent. Complex trauma is ongoing. It's ongoing harm, ongoing neglect, ongoing physical abuse, sexual abuse, substance abuse, ongoing lack of a parent being there due to incarceration, ongoing for a substance abusing parent who is not there mentally or physically. It could be a lot of different things. And then the secondhand trauma is many of us have experienced, and probably the easiest one to tell you, most of you today, is just say the word 9/11. We all experienced that. We weren't necessarily in the building, but we all, for days, watched this over and over and over again. And we saw what happened. So we have that collective experience. But, when you see a child, or you see situations as a professional, working with that child takes an emotional toll. And this is called compassion fatigue. I had a student who worked with some children in a classroom, and I've been teaching classes on trauma. I'm in the 2nd year of doing that, and she sent me a thing. I can't be at a class tonight. I just had one of those days. I had to leave. I didn't want to, do anything with that child. Megan, I see just here, there's 23 chats. Are the questions all similar? Are they?
Yeah, we've got one question here.
Okay.
And it's actually perfect time for it. Joe has a question. With the rise of technology and the ability to see more traumatic and disturbing imagery at an early age, are children becoming more desensitized or more affected?
That's an interesting question. And I will have to say, and I've just got this book, if any of you have girl children, you need to buy it. I attended a trauma conference this last weekend, and it's called Girl on the Brink. And it's how girl children are different. And it has to do with all kinds of things, including their estrogen. And they're more sensitive. We have more young people, especially young women, who have anxiety and depression that we did not have before. And in some ways, they're desensitized. but in other ways, they are been so sensitive to it, it is causing issues. And this includes estrogen and things going on in the brain. So it's a very, very, very big issue. And so if you have a girl child or girls in your family, this is a book. I bought it to give to my daughter who has almost 9-year-old, but I'm going to read it first because I was really impressed what this woman said. And we need to, my whole thing with getting involved in trauma is I want to prevent the children who are very young right now from getting into schools and having traumatic things and not learning the way they need to learn, and having all these emotional issues that will show up when they're teenagers, that will show up in their bodies when they're young adults and adults. We can help cancer, and we can help heart disease, and we can help diabetes, and we can help obesity, and we can help all of these things. And you're going to learn a little bit why by dealing with this now, early. They've been talking about doctors being at the forefront and all of that, and elementary school and middle school teachers and high school teachers being at the forefront. But guess what? Those kids had to go to preschool first, most of them. So we really are at the forefront, and it is now, I think it's up to us. I think we are the ones that can make a difference if we can help children early on. So why? Well, we have to help support them emotionally, socially, cognitively, physically, and linguistically. They learn so much. And if they're home, and I think parents need to have this information, at least those parents who are not neglectful and those parents who are caring, which I think is the great majority of parents. But teachers play a role, because this is, and I'm going to, I added a little bit of something to this. I practiced last week with Ryan, who works with Megan, and it went really well, but I just felt that there was something missing. Unfortunately, from that time on, I had learned more about what I had wanted to include. So I feel now I can include it. Trauma in early childhood affects brain structure. Bruce Perry will tell you this. Jack Shonkoff will tell you this. Lots of people will tell you this. It affects the brain. It affects how children act and react. It's a little bit more than that, though. It affects, and because it affects the brain structure, and that what I said to you as far as children being under the age of 1, it is the brain structure that is affected. And so when that brain structure is affected, the cognitive development is lessened. The social emotional development is lessened, and behavior problems increase. The ability to learn isn't as easy. And if you have not developed socially, emotionally, and behaviorally in order to be able to form healthy attachments to others, that is an issue. You think of children in classrooms that have some of these behavioral issues, and they're just trying to get through a day, much less making friends. And that's become even harder since COVID. That's one of the things, our ability to form healthy attachments to others. Those children, and my granddaughter was in kindergarten when the beginning of COVID, and she was, getting attached to all of these friends and everything. Well, she didn't see other kids for 2 years. It was 2 years, and pretty isolated. She's got an older brother and a mom, and her parents are divorced. So she, kind of going back and forth. But, just now in the 3rd grade, she is really beginning to form attachments. But it's like, it's backed up for a lot of kids and their physical health. So what can all of this, going back to the brain structure, And, you know, everything from the cortex to the hippocampus to the limbic system and all of that, and the brainstem. We haven't given that silly brainstem enough credit. We think of it as the animal brain, but it's a lot more than that. There is a nerve, a set of nerves that are in the brainstem called the vagal nerves. And there is a doctor, his name is Stephen Porges, who came up with this theory and first exposed it in around 1995. So it's been around for 28 years now. And he's a physiopsychologist. I think that's how you describe it. Studied the neural system. Well, in that vagal neural system is a two-way going back and forth. One of the vagal nerves goes directly to the heart and the head, the facial structure. So this is what is used, you know, looking at a baby, baby's looking at you, you know, that's all connected. The rest of it, rest of the nerves are going down to the rest of the part of the body. And when, in order to feel safe, all of those systems need to be kind of at rest. But when things happen and somebody has been through trauma and they are in toxic stress, which is what happens. And I've gotten to the point, I don't care what got you there. What happens is you have trauma and you are in toxic stress. And what is happening is that this is causing your body to react. And children can't help it. They cannot help it because their body, their brains have been changed and their nerves have been wired for this fight or flight or shut down and freeze because of trauma. So when we have that, this is our social engagement system, our ventral vagus. And so this is where we communicate and we connect, and it's in the face and the throat and the chest. And it helps us in our ways to digest and to rest and engage with others. Well, if you are a child who is neglected, you may not have developed connection or communication. So this system may not be working as well, but the neural system for shutting down and collapsing might be working really well. And let me give you an example. I would say it was right around 1990. And I had students they were nanny students. I started out teaching the nanny program. The nanny students were working in the lab, and two of them who this was the first year they'd been out of high school, and they show up with this 5-month-old baby. It's a fall day. It's not cold, but it isn't warm by any extent. And they show up this baby with diapers and a t-shirt and a bottle. And I don't even know what was in the bottle. I'm hoping it was apple juice, but God knows what. And they said that the friend of theirs was working, and she had this baby, and her parents threw her out of the house. And so she was taking this baby with her and going from couch to couch to couch and trying to work to provide for the baby. So the baby really spent virtually no time with his mother. And these two girls were drifty at best, mentally. They just, they were teenagers. They didn't know how to take care of a baby. And then, their friend just kind of, here, take this kid. I have never, ever witnessed what I saw in that child. That child was totally shut down. There was no effect. The the little boy just shut down. No eye contact, no smiles, no frowns, nothing, just completely frozen. And for years I wondered why. And then, you know, when I realized that it's in that vagal nerve area, in the nerves, and for years we've thought that the brain top down is how things work, but actually what we're finding out, it's the bottom up, from the brainstem up. So the brainstem is giving the messages to the hippocampus, the limbic system, the cortex, and all of that. And the nervous system, the sympathetic nervous system, which we have in our spinal cords areas, this is the first line of defense. You know, we're mobilized. You know, our heart rate increases and our breathing gets shallow and we get muscle tension, and the body is mobilized to deal with the stressor. Well, what happens to a child that has had enough trauma, especially not just one single event, but that chaotic type of trauma over and over again, is that they don't feel safe. So it depends on the individual child and their sensory systems and everything. Some children, in order to feel safe, may need to move. They may need to dance it out. They may need to do all of these things. They may need to hold one of those balls or something in their hand, or pop some of those things for anxiety. They need to be moving. It's important for them to be moving. So if you have a child in a classroom where that works, you need to adapt to when they have this issue, you need to get them moving. For others, they need to be quieted down. They need to be maybe doing some mindfulness task of breathing, or yoga. Yoga's got both. It's got the movement and the other. We need to realize that our students need a toolkit of things that they can do to help these children who have been affected by adverse childhood experiences in their lives. That they are dealing with traumatic stress, and this traumatic stress, toxic stress. This toxic stress is causing this vagus nervous system to just be crazy. And so it's important that we have the understanding of what's happening. Because unless you understand what's going on with children, you can't do anything to help them. And we've got to move from, God, why is that kid acting that way? To say, what happened to that child to have that child act that way? And it really isn't even so much of what happened, but you can kind of assume trauma in some form. You don't have to say it was trauma due to X, Y, or Z. You can assume trauma because you can assume toxic stress. And once you do that, how you deal with the child, how you interact with that child, you can begin to come up with ways to co-regulate that child, because the child isn't going to be able to do it by themselves. And parents may be at the end of their rope. I mean, it could be something that they had no idea that happened. And you can say, how can that happen? Well, I know that can happen. I found out many years later that my oldest daughter was molested on more than one occasion by our family best friend, our best friends. And she was acting out in these very strange ways from the time she was 3 or so. We did what we could to cope with it. We had no idea. But what it has done to affect the rest of her life isn't pretty. She was a drug addict for many, many, many years. And so I'm kind of on I want our teachers to do what they can. And I want the parents to understand their role in helping their children and the teachers to understand their role in making changes, because I think it's really important. The big takeaway really is, regardless of what it is, what it does to their brain and nervous systems causes is toxic stress. And that may be their operating mode under most conditions. So if they don't feel safe anywhere, there are things that you can do to help them to feel safe. And this isn't, you know, this isn't what this particular presentation is all about. I wish we had time for all of that. She also likens to this to, you know, when a child feels threatened, it's like you've come upon a bear. And in order to get back to normalcy, you either need to fight the bear, you need to flee from the bear, or you need to freeze. I've heard some people say, well, yeah, if you run into a bear, you're just supposed to stand there and freeze. Well, I've also heard it depends on the kind of bear. This isn't that. This is happening. And so if you're aware and you're informed, that's the first step. As I told you, I've taught quite a few people about trauma, and we've come up with some things for you to do to help children. And just the first class or so, when the students walked out, it was like, oh my God, somebody finally understands what's happening. And even though I may not have the tools right now, at least I know that this child isn't a horrible child. This child is reactive to something that's gone on in their lives. And so I need to be informed as to what I can do to help. So these are some of the typical reactions. And I am sure if you've been in a classroom or your students have been in a classroom, you know, crying or screaming excessively, you can't control them, clinging and fearful, and bad verbal skills, sporadic mastery, which we thought 30 years ago was attached to substance abuse of the parent, may or may not be. Look at all of those things. Difficulty regulating emotions. They can't regulate, much less co-regulate. And the 3 to 5-year-olds or 3 to 6-year-olds, it's even worse. They don't have confidence. They can be physically, verbally abusive. They can act out. They can show inability to trust or make friends, be aggressive. And these kids can have stomach and head issues. The vagus nerve. We have some information that we can take. And, you know, with this pandemic, and I'm not going to spend too much time on this, we had some things that were thrown in our laps, and we're still dealing with them. And we still, in some cases, we're definitely hand washing. What the mask wearing did for kids, because if they can't see you smile or frown, that they couldn't read your facial thing. That's screw, you know, the vagal nerve is going, what is that? I can't see them. I don't know. And social distancing. What happened to those kids who you couldn't hug them because you weren't supposed to be next to them? So that has affected this. It has affected how we operate. And we did try to help children cope as much as we could. We tried to provide stability in a daily routine, which kids need. They need that stability. They need the consistency. They need that routine. And we tried to stay calm, and we tried to provide those relationships. And we listened to children, and we tried to help them cope with honest answers, but we're still dealing with that. We had a lot of food insecurity, so that may have caused traumatic things. Actually, food insecurity from August of 2020 to early 21 tripled for some children. So we have, could be causing an issue. And we know that equity and social justice is an issue for some children. NAEYC has suggested guiding principles that being aware, that self-awareness, humility, respect, and willingness to learn about children and teachers being equitable and equally supportive of children, and knowing diversity and culture and how it impacts the environment, how it impacts the child, and realizing that the families are the main socializing agent. But if they're in trauma, that's going to affect the development of the children. So we know that more than half of the children under 6 are of color, and 40% of the teachers are women of color in early childhood. And some children don't get equal access to either, it could be childcare, it could be medical health care, it could be lots of different things, food. And then social justice and gender development. And I'm not going to talk a lot about that. We're having some real issues in red versus blue states. And it's really a human state that we need to think about this. You know, once you know how children are affected by these recent things, how has it affected teachers? It's affected teachers tremendously. For many years, the turnover rate was around 40%. I have not looked in the last 2 years to see what it is now, but I know that the turnover rate is a lot worse than it has been. And it's harder to find people to teach. And what are we going to do to address this? I don't have solutions. I have more questions, but I think that working together, you and your students, your peers can begin to understand what's really going on with children and what can be done to help them. So Megan, are you there?
I am.
Do you have some questions?
We do. I feel like you touched upon this just a little bit, but perhaps you have a couple further thoughts. Are different ethnic groups affected by ACEs more or less than others, as well as different age groups?
The younger they are, the more they're affected. I would say that maybe 5 years ago, you could say that Asians were less affected, but today, I think they're all probably equally affected. And it depends, you know, a lot of that depends on the communities they're in, that depends on the family support they have. You know, in my community, we have a lot of Middle Eastern people on my campus. There's a lot of Hispanics and Middle Eastern people. Not so many African American. There are a number of Native Americans, so it's a mixture. I think that's probably more circumstantial, and it depends on, you know, maybe the area you live in. I think if you lived in, well, I don't even want to say the state. The state that's having issues now with education. If you're in that state, it's in the very southern part of the eastern part of the United States, you may have more issues as a Black person, and then you may have it as possibly Hispanic, but it just depends. I think a lot of it is the area and circumstances.
Sure. Now, before we get to a couple other questions, I just want to make sure that I mention this quick. I would be remiss if I didn't mention the fact that you have a textbook entitled Safety, Nutrition, and Health in Early Education.
Right.
And it's a really...
Yeah,
go ahead.
The last chapter is on mental health. And I added that. The book was first published in 1998, and I added that chapter, I think, around 2005. And it has increased and increased and increased. And it does have ACEs, it does have the trauma, it does not have the polyvagal theory in it. And I'm talking to Kendall Hunt about expanding that chapter. And even if I don't go into a revision, I will prepare an addendum for the teachers. And I am working now on writing a text. So I'm kind of really down that rabbit hole. So at least now in that health and safety And it does talk about a lot of circumstantial things. And it is a book that looks at the whole child. It doesn't just, you know, I originally recruited to write this book because they wanted somebody who wasn't looking through rose-colored glasses at childhood. And so it's a pretty realistic picture.
Wonderful. Yeah, it's a fantastic title. I can send the listeners today some more information on that too. But I'll go ahead and dive into our questions over here. Kimberly would like to know if you can provide any strategies or framing of these issues that adopt an asset-based perspective.
Oh, an active-based perspective?
Asset.
Oh, asset-based perspective. I think that you have to take each child individually. You have to take the child where they are. You know, it's just like when you first get a child in childcare, and maybe they're a year old and they cry, and by the first week, you know what each cry means. You understand, you know, why they're crying. I think that that's a really good question, because it is so important for each individual child not to be judged, and for each individual child to be I don't know what, looking at what their positive traits are and seeing what you can do with those, and understanding and observing the family. I think that is another thing. If they have a family that appears to be connected, that they have good relationships, that is another asset that you can look at. But it's all on an individual basis.
Excellent. Another question we have is social economic status the biggest factor when it comes to children that experience trauma?
It's a big factor. I'm not sure you could say it's the biggest factor. The person who molested my daughter was a PhD candidate at UCSD in marine geochemistry. So, you know, he wasn't, and you know, they lived in student housing, but he wasn't poor. They weren't living in poverty. I think that relates to a lot of it. Yes. Economics, like I said, you have to look at the whole child, and that applies to the assets too. You have to look at the whole child and the whole situation, the cultural, the economic, the physical, all of those things have an impact, and the social emotional. And if you're, you know, when you talk about poverty, you can really relate that more of that societal impacts of the social justice and inequality. That relates to that too. So I think that it is a big factor. I wouldn't say it's the main factor. Somebody can be negligent and neglect a child and not have poverty in their lives. They can be somebody who is not there, socially, emotionally not there because of the way they were raised. So you know, it's historical, it's poverty, it's so many things. And as I said, you know, individual, they're looking at holistic things for each individual is really what you need to do. It's kind of hard to put labels on. And that's why I hate to say, oh, well, this child has been sexually abused, or this child has, you know, had this trauma because, you know, they were neglected, or this child has that. You know, you just, what is the toxic stress? What caused the toxic stress? What is it? What is the outward appearances? What is happening to the child? I think are more important questions to ask.
Excellent. That's great. Alicia would like to know if this new text is focused on TIC or child development in general, and if you have an estimated date of completion or publication.
I don't think that trauma-informed care has been really looked at closely enough in a child development perspective. When you look at trauma-informed care in the elementary and middle school and high school, it's related to education. And I think it needs to be related for the young children to their development. I think it's really important. And I'm writing as fast as I can. I'm just at the point where I do my research. So I would hope in the next year it would be ready to, maybe by fall of 2024, it would be ready. That's kind of my goal. So, you can send me an email. Megan can give you my email and I can keep you updated if you want me to.
Absolutely. I'll put that in the follow-up when I send out the recording as well.
Okay.
Perfect. Oh, and then this isn't a question, but I just think it's very nice. It kind of speaks to, and I think sums up what you were saying very well. Alicia also says, kind of when, looking at a child and what kind of traumas and things they've experienced, really just valuing them for who they are.
Absolutely. Absolutely. And doing whatever you can to increase that value, especially for the children themselves. Because a child who fights, flights, or freezes isn't going to have a wonderful life if that's how they operate. And we need to value them enough that we give them the tools, show them the way that we can help them live a life where they don't have to look forward to anxiety as a teenager, or heart disease as a 53-year-old.
Absolutely. Do we have any final questions today? All right. I think that wraps it up.
Okay. Well, thank you all for being here. I don't know where you're from, or somebody looks like somebody has a hand raised. Is that? Oh, they're applause. Oh, thank you. I hope that you carry this message into your teaching, that you need to do whatever you can to help those children, because unfortunately there are going to be more of them, and I'm hoping we can stop that.
Yeah, thank you so much, Cathie, for the wonderful presentation today and for all of your knowledge. Thank you, everyone who attended today. We're getting lots of thank yous in the comments here. So we will be following up, providing you guys with the recording of this. Like I said, I'll also include Cathie's email if you have further questions. But until then, have a wonderful, wonderful day. Go keep being amazing teachers, and we'll see you soon. Thanks.
Thank you.